Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Nashua Division of Public Health and Community Services. Before we welcome our guest today, I'd like to give you a little update around COVID-19. If we look at the state of New Hampshire, we've had 270,063 cases. Right now, we have 6,064 cases that are active. Our positivity rate is 11.1%. We have had 747 cases on February 10th reported. Our hospitalizations are thankfully down now to 175. And the deaths in New Hampshire are 2,228. Coming down to Nashua, in the city we have 353 active cases, and our new infections per 100,000 are 892.4. The 7-day total test positivity rate is 14.1%. That's about 3% higher than the state of Nashua. So please continue to use your mitigation measures and wear your masks. Get vaccinated if you haven't already. In Greater Nashua, we have an additional 347 cases. Our fully vaccinated have crept up by a small amount. City of Nashua, 53.9% fully vaccinated. Greater Nashua, 53.6%. All of New Hampshire, come on, let's catch up, Nashua, to 56.6% and beyond. So that leaves me with a question. Are you up to date on your vaccines? What does that mean? That means you've had both series, primary and second, so your first dose and your second dose. And then if it's 5 months past your first series, you are eligible for a booster. Booster doses are recommended for everyone 12 years of age and older, and eligible individuals can choose which vaccine that they receive as a booster. The CDC recommendations now allow for this type of mix and match. So if you're 12 to 17 years old, you are only eligible for Pfizer. And if you've had the J&J vaccine, then you are eligible for a booster 2 months after you've had that first dose. So just a little data, folks. Masks work. At this graphic, you can see, depending on the type of mask you're wearing, 56% less likely to become infected with COVID-19 if you're just wearing a cloth mask. And a surgical mask, 66%. And that N95 or even the KN95, 83% less likely to come down with a COVID infection. So mask up, Nashua. We've got a month to go, a little less than a month. The mask ordinance has been extended through February 28th. We've seen that masks really reduce the transmission of COVID-19. So while our hospitals are literally recovering from such a huge surge, we need to, out of respect for our neighbors and our friends and for our healthcare workers, keep our masks on when we're out in public and in indoor places. The Vaccine Fix site is now open. So that is up on Amherst Street. It is Northwest Boulevard is the official address. It is next to Marshall's. I guess they get a little plug today. But they are open from 8 to 2 every day. You do not need an appointment. So if you're working on your primary series, great. Thank you for going. And if you need a booster, that's your place to go. There's free COVID testing available. These are PCR tests, 9 to 3 every day, 7 days a week. I guess I said every day. It is drive-through, and it's on 25 Crown Street in Nashua. We've got a red month here. I wore red in honor of the occasion, and we have Valentine's Day coming up, and it's Heart Month. So we have our 4th annual Valentine's event, free STD, HIV, HCV testing. And you can do that right on Valentine's Day. And then beyond that, if you're watching this later than that time, please call the health department at 589-4500, option 2, and we'll get you an appointment for that free HIV, STD testing. And just a little photo of my colleagues who wore red for Heart Month. We had a good time last week doing that, so I thought you could all see what's going on behind the scenes at Public Health. And in honor of Heart Month, just want to remind people that it's very important to know your numbers. Hypertension, one of the most controllable conditions that we have. Nearly 1 in 2 U.S. adults have hypertension, but only 1 in 4 have it under control. Are you one of those people? Check there's places to check your blood pressure that are free. You can do them in pharmacies and grocery stores. You know, pull on up to one of those cuffs. Make sure that you're at 120/80 or below, and call your doctor. Call your doctor if you are having an elevated blood pressure. And finally, I do want to announce that our Community Health Improvement Plan has been released as of yesterday, and we are focusing on 5 priority areas over the next 3 years as a community. We're looking at communicable disease, public health emergency preparedness, behavioral health, maternal and child health, and chronic disease. So please search Nashua CHIP, and you can learn more about all the initiatives and all the programs and ways to get involved in the community. And now I'm really pleased to introduce my guest from the Greater Nashua Dental Connection, Myra Nikitas. Welcome.
Thank you so much for having me today.
So Myra's a public health dental hygienist. So
yes.
There's 2 different distinctions, but first you were a dental hygienist and then you were a public health dental hygienist. So
yes.
Tell me about the difference and what it means to be a public health dental hygienist.
First I want to say thank you again for having me today. It's an honor, and I'm truly grateful. I've been a hygienist for over 15 years, 17 years to be exact. I went to school, graduated at the New Hampshire Technical Institute in Concord, one of the only programs in New Hampshire that offers dental hygiene for the state. So I became a hygienist and just recently became a certified public health hygienist. So we go through a rigorous course work as become a dental hygienist, and it's additional schooling and classes that we need to take to become certified by the state to become a certified public health hygienist. So I was in private practice for many years and just had a calling to do more. So I became a certified public health hygienist, which enables me to go into nursing homes, schools, to do dental screenings, apply fluoride varnish, do dental cleanings, do a lot of preventative care for those that are in areas that patients can't always go to the dental office.
And we're all about prevention and public health.
For sure.
You know, it's nice because it takes you out of the dental office. No offense to dental offices, but it gets you out to where people are.
Yes.
And that's so important because people have busy lives and people have limited access.
For sure.
So, you know, especially in like the nursing homes or the schools or places where, you know, we always like want to meet people where they are, especially those that are most vulnerable in our community.
Absolutely.
That just may not have the time. So if they're making one appointment, they can maybe meet their hygienist at that appointment as well.
Absolutely. And being able to serve some of these areas that are underserved or can't make it to the dental office is huge. And it definitely takes a special person to be in public health. You definitely have a calling and want to help the community and help those that are in need.
So I want to preface this too, like we were talking a little bit before the program about oral health and how oral health is a big public health issue, often gets overlooked. And so I want to talk about that a little.
Sure.
Like why is it a public health issue? I mean, I have a million reasons, but educate our audience here.
Sure. So it's definitely a public health issue. There at the Greater Nashua Dental Connection, we serve patients who are uninsured, who are covered through Medicaid. And as we know, Medicaid only covers a very limited amount of services. So if you have a toothache, if you're in pain, you want a tooth out, Medicaid will cover that for patients over 21. Patients from birth to 21 have their cleanings, fillings, any dental work is covered under Medicaid. But unfortunately, after the age of 21, those preventative services are no longer covered. Dental care is expensive. So those who are struggling financially aren't going to go to the dentist for preventative care. There at the Dental Connection, we offer services at a discounted rate through the fees of Medicaid, so that we are able to see these patients and they can afford dental care. We offer a variety of services at the Dental Connection, ranging from cleanings to simple extractions. Dentures are made there, fillings, and just a lot of education. I take pride in trying to educate patients why the importance of oral health is important and connected to our overall, or connected to our whole body. And a lot of times I think that's neglected because we're not conscious of that.
And I think with oral health too, I mean, we had said before the mouth is connected to the body, or let's put the mouth back into the body. We have a separate insurance system for oral health versus medical care, medical health. And, but oral health affects so many aspects of our life. So, you know, even from the very young child, if they're having a lot of cavities or dental caries, as you would say in the profession.
Yes.
Or, you know, if you're don't have access to dental care throughout your lifetime and you are trying to get a job, and you know, unfortunately people are judged, and you know, if you want to have a smile that you know that you can present to the outside world, because that's unfortunately, for better or worse, this is part of our society. So just in preserving that, and also the other healthcare issues that come along with, you know, with having a tooth infection, and can that affect your heart or those kind of things?
For sure. So, you know, preventative care helps us realize that, you know, being mindful and taking care of our teeth and being conscious of the foods that we eat, you know, high in sugar. And this starts at a very early age. If we can educate our kids that it's important to brush your teeth twice a day, it's important to floss, it's important to be mindful of the foods that we're eating because of breaking down the tooth and causing cavities. It's unfortunate that a lot of times when they come to the Dental Connection, some of these patients, you know, are in pain and they have a toothache. I feel that, you know, public health is different than private practice because the patients that I see have gone in for a tooth pain or toothache, and then are kind of educated that we need to, you know, get you in for a cleaning, get you in for some x-rays and so forth. Whereas private practice, you know, you see your hygienist every 6 months, it's covered with your insurance, and then, you know, you see the dentist for any fillings or any other restorable needs. So, you know, it's important that we educate our patients when they come in for a toothache that this could have been prevented by, you know, whatever, brushing, flossing. A lot of times some of the patients don't have those tools to continue good habits at home. So we take pride in you know, working with and donating a lot of toothbrushes or tools that, you know, floss and toothpaste to the shelter, to schools. We work very closely with the United Way, who is a big sponsor and supporter of the Greater Nashua Dental Connection, to be able to offer these necessities really to continue good oral habits.
Yeah, it's just so important. It's and I think, you know, it's interesting the way you framed it, because, you know, you say the people that have a dental home, so to speak, go and get their cleanings. They're actually, that's what we want in public health. We want that prevention before the problem. So unfortunately, we need to reverse that so that the folks that are coming to the Dental Connection are also coming for cleanings. And also coming for that preventive work. So I just want to back up because the Dental Connection, tell me a little bit about the history of the Dental Connection and how it was started and how you staff it, because, you know, it is a nonprofit. And
it is a nonprofit. The Dental Connection was founded back in 1999 by Dr. Giftos and other members of the community. So they found that it was a great need in the area to develop a clinic where patients who don't have dental insurance or just maybe can't afford dental care can come to the Dental Connection and get good quality care. So we have many supporters throughout the community. We are a non-federally funded dental clinic, which means that we don't get any money from the government. So we rely solely on grants and the generosity of the community to support us. United Way is a big supporter of us. St. Joe's Hospital, we get various donations and grants. We just recently got a $5,000 grant from the Bishops Association,
Nice.
Charitable Foundation, and this is just for kids. So they'll give us money and say, okay, we want this money to go towards, just seeing kids, or so it's great. We just recently expanded our clinic to help with the need of influx of patients. So we have one full-time dentist. We have volunteer dentists as well. And we have another part-time dentist, and we're going to be getting another associate very soon, hopefully in the next month. So we'll be having hopefully 2 full-time dentists. We have 3 dental assistants, 2 office personnel, and I am the only dental hygienist
Only
right
one.
now in the
Wow.
clinic. So, and then our executive director. So our clinic is run by a board of directors, and so yeah, it's an important place, and we call it the no judgment zone. We have various patients with different conditions or different,
Which is so important. It's not your fault. It's not your fault that you have a
Exactly.
cavity, or that your tooth is falling out, or that you are in pain. You didn't do anything wrong.
Exactly.
That is a really important point that you're making.
Jane, I want to just throw this out there too. The #1 reason why a child will miss school is because of a toothache.
Oh.
So, we at the Dental Connection try to partner with the schools in Nashua to be able to give them the access to dental care. A lot of parents work, Monday through Friday, 8 to 5, and so they can't take time off work. They take time off work, less money in their paycheck, which could go towards, food or heat, especially in the winter months.
So prior to COVID, I know that you had a pretty robust program where you were going into the schools.
Yes.
Tell me about that one.
So prior to COVID, we would go to the various schools in Nashua. We would bus kids to our facility. We have either a first student would help us. We have a dental van as well. We would bring the kids to the clinic. We would do preventative services, cleanings, x-rays, sealants, fluoride varnish, and if there was time, any restorative needs, for the child. And unfortunately, because of COVID and the shutdown, with kids being remote, we weren't able to be able to go into the schools.
So are you back in the schools? I know we talked about that a little bit on the phone, but where are you right now?
So we were back in the fall, and then unfortunately the variant came out. So we've been kind of on pause at this moment. We work very closely with all the Nashua nurses, and they know that if any time there's a child that has a toothache or goes to the nurse's office or needs a dental home, we are there.
That's great.
We did, during COVID, unfortunately our hands were kind of tied. We couldn't go into the school, so we did a dental day for these kids, and with a sponsorship from Northeast Delta, and we were able to provide these kids with a dental screening. It was a drive-up dental screening. The children, we would see them very quickly for a dental screening, provide a fluoride varnish, and then kind of just talk to mom and dad or whoever brought the child in that, we see something that needs some urgent care, maybe just, areas that would look suspicious, and they would get a goodie bag and drive away. So.
And those were successful. You
Those
had
were
a good
pretty
turnout.
successful. Yeah, we worked very closely with the superintendent's office and Stacy Hines to do a robocall to let the parents know that, we were there. We try to do it on days that the child doesn't have school, so maybe a school vacation day or a holiday, so that parents would be more apt to bringing the child.
It's a great time. You can deliver a quick education.
Yes.
And
Yes, and unfortunately, the 2 times that we did it, the turnout was pretty good considering it was pouring rain.
Oh, of course.
And the weather wasn't as cooperative.
Yeah. So, why is it so important to set kids on a strong? So it is the reason I thought to call you for this show is because it is National Children's Dental Health Month,
Right.
and I know how much work the Connection does with the
Yes.
kids. So, but why is this so important? Why is it important for them to have such a strong foundation?
It's so important because at such a young age, you know, we can provide them the education of why it's important to continue good oral habits, brushing, flossing. You know, unfortunately, it's something that, you know, we work very closely with parents. Just the education part is so important. As we know, you know, over time, as the child grows, they can take these important habits with them and try to continue. So we see a lot of, you know, a child who has rampant decay or may have some other systemic issues going on as well. So it's a way for us to, you know, maybe they're not seeing a doctor regularly. Maybe this is the only chance that this child will, you know, come to see a doctor, is coming to the connection and having an exam. So it's really important.
Yeah, and then when should, so this is because this, I learned a lot of this when I worked for the Oral Health Coalition, but when should kids start getting dental care?
So as soon as their first tooth erupts, you know, we see children all the time from 6 months even to a year, you know, and they're not always the most cooperative patient, but at least it's more of an education, talking to mom, dad, guardian about not putting the child to bed with a bottle, you know, brushing those teeth and giving them the tools to do so. So even at an early age, you know, we try to really instill these good habits.
I did, when back in the day, I did watch a dental assistant and a hygienist in a WIC office, and they were counseling the mom. She had a very young baby, just to take a washcloth and just to clean the little tooth, the little chiclet that was right there.
Yes.
Which I didn't realize, you know, this was way past when my kids were little, so I was like, oh, I didn't do that, but it sounded like a good idea.
And you're finding, Jean, that, you know, years ago we didn't have the knowledge of prevention as much as we do today, that, you know, the good healthy habits start from the mouth. So brushing, flossing helps our heart, helps our body. So it's very, very important.
So you mentioned brushing and you mentioned flossing, and then you also mentioned avoiding sugary foods and drinks. Let's talk a little bit more about that, because avoiding these things go a long way for kids and adults.
Absolutely.
And when we talk about, you know, we're seeing a huge increase in type 2 diabetes, which we know is directly correlated to some of that consumption. So that's why, again, the mouth is part of the body kind of thing. So just let's talk about like that whole sugar thing.
So, you know, we educate even parents and children that if, you know, if they like soda, they like different sports drinks or such, you know, at least rinse your mouth afterwards with some water if you can't get to a toothbrush or floss. And maybe use something that's sugar-free. It's very important. A lot of, you know, elderly patients or anybody really, if they're on any medications that cause dry mouth, you don't have the salivary flow in your mouth to remove any, you know, stuff on your teeth that's going to start to break down the tooth. So all these things are so important to, you know, tell patients that sugar, you know, it's bad for you, but hey, everybody loves, you know, a good little Hershey bar or cupcake or something.
I am included
in
that group.
Me too, me too. So, you know, it's just taking everything in moderation, right? And just being able to, if you're going to have something like that, maybe just rinse your mouth with some water, chew, you know, sugar-free gum.
Yeah, I was going to ask you, what do you look for in the gum? Is it xylitol?
You could do xylitol. You know, anything that says sugar-free. Recaldent is another good ingredient in some of the gum or sugar-free candies. So,
because I do know, like, they used to recommend some of that gum.
Yes, and especially for patients who have dry mouth that just don't have that saliva in their mouth. You know, anything sugar-free to be able to, you know, get those juices going there.
So, in the ideal world, how often should we be cleaning our teeth?
So in the ideal world, I say, you know, at least minimally twice a day, before, you know, breakfast, after breakfast, in the morning when we get up, and then at night before we go to bed.
And what about actual cleanings at the dentist's office?
Cleanings,
or at the connection?
Sure, every 6 months.
Every 6 months.
Every 6 months. We do have some patients that we see more frequently. And that's okay too. Some people just develop a lot more deposit in their teeth. Some people are just a high caries rate. So we want to see them more often to kind of keep everything in check.
Yeah, no judgment.
No judgment.
Just because
no
you get a lot of that
Yes.
stuff on there.
You get a friendly smile under this mask and just a warm embrace there at the connection.
Yeah, that's great.
We're a great team.
And you're able to do any kind of secondary work. You know, if they're coming in for a cleaning, that you
Yes.
can do the fillings and those kind of things.
Absolutely, absolutely. We do, you know, we come in for the cleaning and then we get you scheduled. You know, if we don't have time in the schedule that day for any fillings or restorative treatment, we do dentures. We do a lot of great things there. Very more affordable.
I have to ask, what do you do if you have a patient who does not speak English? Because we do have quite a large community in Nashua now.
Our brochures are translated into 5 different languages. We do have somebody, luckily, in our staff that is Spanish speaking, so a lot of times that is a huge help. Even our phone, you know, we can translate. If we're trying to say something to our phone or Google Translate, and you know, technology has gone a long way. So we make it work. We, you know, write things down, speak very slow. And so, like I said, there's no judgment zone there. We're open to all, you know, walks of life and various languages to the best that we can communicate with them.
Well, this is great, and thank you for all the work you do at the Greater Nashua Dental
Thank
Connection.
you.
And I want to remind people to see their dentist,
Yes.
to brush their teeth.
Absolutely.
And also, if you are in need of dental services and cannot afford them or need a lower cost, please, you know, call the Greater Nashua
Yes.
Dental Connection. They're not going to turn anyone away.
No.
And it's a great resource for our community. So thank you for all the work you do.
Thank you very much.
And thanks for
It's an
being
honor.
on. And thank you for joining us. I do want to remind you that there's free COVID testing available 9 a.m. to 3 p.m., 7 days a week on 25 Crown Street. And boosters and all presentations of the vaccine, first, second, you name it, shot is available on Amherst Street at, it's actually 34 Northwest Boulevard, but it's next to Marshall's in the Market Basket Plaza. And please come visit our health clinic, 589-4500, option 2, immunizations, Tuesdays, Wednesdays, and Fridays, STD testing, Wednesdays and Thursdays, and lead testing, Tuesdays, Wednesdays, and Fridays. Remember, folks, we're part of the solution, so be part of the solution too. Get vaccinated, keep those masks on when you're out in public. Don't get too close to everybody. I hate saying that, but it is what it is. And wash those hands well, and we'll see you in a couple of weeks.